Okay, folks, so what I wanted to do was make this short video just based off of many of the common questions that come about when speaking to individuals who are turning 65 for the first time and they're trying to decide between getting a Medicare Supplement plan or a Medicare Advantage plan. So what I'm going to do is go over the basic questions that I hear most often. First one being, why do I need a secondary insurance for in the first place? Well, technically speaking, you don't have to have one. Between Part A and Part B of Medicare, they pay 80% of your hospital and medical related expenses after you've met your deductible for Part A and Part B. And the other 20% is going to be completely your responsibility to cover. If you have the financial means to do so, by all means, you do not have to sign up for a secondary. But if you're like many of the folks that I speak with, they don't have I shouldn't say they don't have, but they would rather not roll the dice and potentially be responsible for 20% of a hospitalization stay. Let's assume, hypothetically speaking, you had a major illness or injury and you were in the hospital for several weeks and you racked up $250,000 worth of medical bills due to your hospital stay. Well, 20% of $250,000 would be $50,000. So if you have the funds available and you have no problem paying a $50,000 bill, then no, I guess you wouldn't have to have secondary coverage. But if you're like many of the folks that I speak to, I think having a secondary would be a wise decision. Next question. Is Medicare free? Yes and no. Medicare is basically made up of two parts, Part A and Part B. Assuming you have worked for at least 10 years or 40 quarters and you've contributed to Medicare with your paychecks each pay period, your Medicare Part A is typically going to be no cost, or you won't have a premium associated with it in most instances. But your Part B, there will be a monthly premium associated with it. For 2016, if your income is $85,000 or less, your Part B premium will be $121.80. So Part A is typically free, but Part B does have a premium associated with it. Next question. Do I need to enroll if I'm currently covered by my employer coverage? That's a very good question, and excuse me, it's going to vary from company to company. Some employers, I find very often those who work for the government or the state of some sort, or for the there used to be former teachers. They very often have the option of having their current insurance become their secondary insurance for them. So upon enrolling in their Medicare, the health insurance that they had before getting on Medicare will go into the secondary position, and that will act as their secondary. So they technically would not need to get something to cover that. What you want to find out is just how much it would cost you, how much you would have to pay for your premiums in that scenario, and just compare and see if it would be more advantageous or less expensive for you to get your own supplement plan or Medicare Advantage plan and just kind of weigh the pros and cons between what your company is offering you versus what's available outside of that. Next question is there a best plan for everyone? And the answer to that would be no. There is no one size fits all. Each person's situation is different. Your health will play a major role in determining which route to go. If you're someone that has some health issues and you have to see a doctor or a healthcare provider on a fairly regular basis, then your needs are going to be different than the person who is very healthy, doesn't take medications, they rarely ever see a doctor other than when they're really sick or other than maybe just getting their annual checkup. So, in both of those scenarios, you're going to have different needs. If you are someone that does have some health issues and need to see a doctor often, you may want to look into getting a supplement plan, particularly if this is your initial enrollment period. Your cost can be minimized quite substantially by going with a supplement as opposed to a Medicare Advantage plan. The Medicare Advantage plans on average do have maximum out-of-pockets, which can be several $1,000s. Very often I see max out-of-pockets anywhere from $6,000 to $7,000 on many plans. So, between having to cover what you're responsible for, that can add up very quickly. And depending on what your financial situation is, that could end up being a burden if you have a Medicare Advantage plan. If you have a supplement plan, kind of depending on which one you select, if you went for the one that is the most comprehensive, like the Plan F or Plan G, or many of the supplements do a good job at limiting your maximum out-of-pocket for the year. But particularly the F, the G, and the C as well, your max out-of-pockets are very low as opposed to one that could be several $1,000s with a Medicare Advantage plan. Next question I hear quite often is, can I enroll in a Medicare Advantage plan now and then switch to a supplement plan later on down the road? Technically, the answer is yes, you can do that. That option is available to you. However, once after the first year, your initial enrollment period is no longer available to you. When it comes to a supplement plan, the very first time you become eligible, you have a guaranteed issue where regardless of what your health condition is, an insurance carrier cannot turn you down for getting a supplement plan. You get that once. Once that has gone, any other time that you try to apply for a Medicare supplement plan, you become subject to medical underwriting. And if you do have some health issues, depending on the severity of them, you can get denied getting a supplement plan. So that's something you definitely want to be mindful of. If you have some health issues, particularly, you may want to lean towards a supplement plan, just from a maximum out-of-pocket cost perspective, as opposed to if you went with going with a Medicare Advantage plan. But having that guaranteed issue that's made available to you when getting a supplement plan can be extremely beneficial for many serious illnesses that someone can have. So just keep that in mind when choosing, again, particularly if you do have some serious health issues that you have to seek your doctor's care for on a regular basis. Next question is, do Medicare Supplement plans also cover prescriptions? And if not, prescription drug coverage, that is. And if not, how much do they typically cost? The supplement plans that are written as of this time period, they no longer cover prescription medications. Many years ago, that was a different story. But if you are hospitalized, the medications you receive while you're in the hospital, that is typically covered. But for your outpatient prescription medication that you would normally get from your pharmacist, those, if you were to go with a Medicare Supplement plan, you will have to get a separate Part D drug plan. If you were to get a Medicare Advantage plan, many of those do have the prescription drug coverage built into them, so you would not have to get a separate drug plan for many of the Medicare Advantage plans that are out there. Your agent or whoever is helping you get or choose can find out specifically for you if your Advantage plan comes with prescription drug coverage in there or not. Next question. I'm healthy and I don't take any prescriptions. Do I still need to sign up for a prescription drug plan? Technically, you don't have to, but the problem you're going to run into is that if you wait until somewhere down the road, there is a very high probability that you will be charged a late enrollment penalty for doing so. I understand that you may be completely healthy and have no need for any prescriptions at this time, but Medicare would prefer that you enroll and have that coverage in place as opposed to having to wait. One never knows when a serious illness can occur, and here you are with no prescription drug plan. It'll take some time normally to process your application and what have you, so it is advised that you get your drug plan when you first become eligible for it, as opposed to waiting, even though you may be healthy and not in need or taking any prescription medication at this time. Another question is, if you were me, which one would you pick? Personally, I would lean towards the supplement plan. Particularly the Plan G supplement, simply because I would lean towards the supplement plans because they are simpler to use, in my opinion. There's less hoops to jump through. There's less things to be concerned about. I know for many of the people I speak to, I've heard stories where a doctor that they've been seeing for a long period of time is not in the network of their Medicare Advantage plan. Medicare Advantage plans, you typically will have to deal with a network of some sort, whether it be an HMO or a PPO plan. If you were to get an HMO plan, pretty much every doctor that you go to has to be in the network. With a PPO, you do have the flexibility of going outside of the network. However, you will typically pay more for any doctors or any medical services you get done outside of the network. You don't have those concerns with a supplement plan. Typically, as long as your healthcare provider or whoever it is that you're going to takes Medicare, you're good to go. You're able to pretty much travel the entire U.S., and as long as Medicare is accepted at where you're going, you're good to go. With the Medicare Advantage plan, you always have to be checking and making sure that these doctors or hospitals are in network. You may will have to give a call to the number on the back of your card and first verify. Other than the instance where it's an emergency, you're able to go to a hospital or facility that's not in network. But for most other instances, staying in the network is something you must always be cognizant of with a Medicare Advantage plan. And this is not something you normally have to be concerned with when you have a Medicare Supplement plan. And the final question that I get frequently, that gets brought up quite frequently, is I'm on a fixed income and some of my medications are very expensive. What should I do? In a case like that, I would suggest checking with Social Security for their extra help program to see if you qualify. That's something that I very often help individuals with. It's a very simple process. I do not charge to do that for you. Just simply get in contact with me, and I can help you get in contact with Social Security, fill out an application, and within a few weeks, you'll get an answer from them in the mail as to whether or not you qualify based on your current financial situation. So it's a fairly easy process, and in the event you do qualify, it can greatly help reduce the cost of those expensive medications. You may also qualify for some other programs that's available in your state that can help lower some of your other Medicare related costs, such as maybe paying a portion or having the full amount of your Part B premium paid for you for some of these other programs that become available to you if you do qualify for the extra help. So that's something we can also help you with applying for that. So these were the topics that I most frequently get asked or gets brought up during the discussions when speaking with individuals trying to determine what their best options are, or what are some of the major differences I should be made aware of when trying to pick between getting a supplement plan or a Medicare Advantage plan. So hopefully this was helpful to you. If you have any questions, please feel free to click the link in the description. That'll bring you over to our website where you can give us a call or send us an email, and we will be more than willing to help answer any further questions that you have or anything else that you may need clarification on. Until next time, have a great day. Bye.